Hello. So today in chapter 14 we're going to look at an overview of the autonomic nervous system. So recall back from chapter 11 that the nervous system is made up of both a somatic and autonomic nervous systems, and with the autonomic nervous system you have your sympathetic division and your parasympathetic division. Remember, sympathetic is fright or flight, or fight or flight, whereas our parasympathetic is our rest and digest. They are both constantly working together to maintain homeostasis. Because they are autonomic, we don't have to think about them. They happen voluntarily or involuntarily. And so they oversee most of our vital functions such as heart rate, blood pressure, digestive, urinary processes without conscious control. So involuntary control. Same as we looked at before, comes in through an afferent neuron, integrated in the central nervous system, goes out via an efferent, but notice a difference here. When we looked at the somatic, it was one long neuron sending the signal out. But with our autonomic, we're going to have a two-chain system. And so we have a preganglionic neuron that synapses with the postganglionic neuron. And this is going to happen out in the peripheral nervous system, usually in a ganglia. And an autonomic ganglia. Remember that nuclei are where the neuronal bodies are housed in the central nervous system, whereas ganglia are where our neuronal cell bodies are housed within the peripheral nervous system. So here you can see a comparison. Again, the somatic nervous system, usually myelinated, one long axon, targets skeletal muscles, and is voluntary. Whereas the autonomic nervous system are going to be a two-chain, and it is going to innervate smooth cardiac and glands, and it is involuntary. And here's just a very close-up depiction of the one neuron in our somatic versus our two-chain ganglion system in our autonomic nervous system. And so between our sympathetic and our parasympathetic, we do have some slight differences. The preganglion and the sympathetic comes off the thoracic and lumbar regions of the spinal cord. Remember, thoracic is around the rib cage, lumbar is your lower back. And you have a very short axon on the preganglionic neuron. Synapses in a ganglion with the postsynaptic, and the postsynaptic has a long axon that then integrates the target cell. So here synapses occurs closer to the central nervous system, whereas with the parasympathetic, our preganglion is a long axon. It synapses closer to the target cell, and the postganglionic has a short axon. And so these are going to synapse closer to the target cell than to the central nervous system. Parasympathetic also comes off the brainstem or the sacral spinal cord. So these guys are coming off the middle. This is coming up the top and bottom of the spinal cord. All right, so let's focus on our sympathetic nervous system. It exhibits these following characteristics: thoracolumnar division. So here's all this red. These are all our sympathetic division coming off the thoracic and lumbar regions. They synapse close to the CNS. And so the preganglionic is a short axon, and it is our fight or flight division of the autonomic nervous system. So used in emergency use situations. So anytime you get really nervous, get very physical in what you're doing, think of what happens. You start to sweat, your heart rate increases, your breathing increases. Also mediates those responses to emotion. With our parasympathetic, comes off the brainstem up here. This is the green brainstem, and the sacral region has a long axon for its preganglionic synapses near the target organs, and that postganglion has a short axon. This is our rest and digest, known as our sacral division, and so closer to the targets and comes off the brainstem and the sacral region. So it's our craniosacral division. But they balance each other out. So one sometimes predominates over the other, but the other keeps the other one in check. So they balance to ensure homeostasis is preserved in our bodies. All right, our sympathetic nervous system, coming off the thoracic and lumbar regions. They synapse in our sympathetic chain ganglion. So this is our chain ganglion going on either side of the spinal cord. And so they have a short preganglionic axon, but a long postganglionic axon. They supply the head, neck, and thoracic viscera, whereas the lumbar supply an abdominal viscera, extend beyond the gang chain left, forming splenic nerves that synapse with collateral ganglion on the aorta. So here's some ganglionic bodies on the aorta itself. Can take different paths. So it can come out into the ganglion. So here's our ganglionic chain. And then come over here and go down or go out to that collateral ganglion. Remember, the collateral ganglion are these over here that we saw that are closer to our targets. Can descend and ascend the neuron with different chain ganglion. Postganglionic neuron can also just go directly. And so it can go directly out where it came in. And as I just showed you, can also pass through one of these collateral ganglions. Neurotransmitters of our sympathetic nervous system. So remember, a neurotransmitter is going to bind to a specific receptor on the target cells or the postganglionic neuron. For our preganglionic neuron, it will always be acetylcholine. So acetylcholine used in excitatory synapses between our preganglionic and postganglionic neurons. And then those postganglionic neurons are going to transmit the action potential to the target cell. The target cells are activated by the postganglionic neuron by all three neurotransmitters, acetylcholine, epinephrine, and norepinephrine. Epinephrine, also known as adrenaline. Norepinephrine is noradrenaline. The norepinephrine is our most frequently used neurotransmitter, whereas epinephrine is used more like a hormone. And so preganglionic only releases acetylcholine, whereas postganglionic and the sympathetic releases acetylcholine, epinephrine, or norepinephrine. The epinephrine and norepinephrine bind to adrenergic receptors. And so the type of receptor that the epinephrine will bind to is adrenergic. You have 5 adrenergic receptors: alpha 1, alpha 2, beta 1, beta 2, beta 3. And so alpha 1 you're going to find in smooth muscle cells of many different organs throughout the body. Alpha 2 is a specialized receptor, and we'll see it in just a minute, and it actually is on the preganglionic sympathetic neuron. Beta 1, predominantly found on cardiac muscle cells, certain kidney cells, and adipose cells. Beta 2, smooth muscle cells lining airways, wall of the bladder, skeletal muscle fibers, and cells found in the liver, pancreas, saliva glands. And beta 3, primarily in adipose cells and smooth muscle cells of the digestive tract. Cholinergic receptors, so those that bind with acetylcholine, and so you got choline in here, so acetylcholine and choline, so cholinergic, acetylcholine binds to cholinergic receptors. Two types of cholinergic receptors are muscarinic and are nicotinic. And pharmacologically, in the sympathetic nervous system receptors, different subtypes have provided targets for medical therapy for many different years and many different diseases. So beta blockers are going to help control high blood pressure because they are going to work on the heart, and the heart is one of the major determinants of blood pressure, with the rate and the force with which it contracts. Also, inhalers help with asthma, to open up your airways. Now here is that alpha 2. It is a unique receptor. And so remember, acetylcholine is always released by our preganglionic neurons. And so the preganglionic has alpha 2 receptors. When alpha 2 is stimulated to be released, or when epinephrine and norepinephrine stimulated to be released by our postganglionic neuron, it can actually diffuse back, bind to the preganglionic, and shut off the release of acetylcholine. So it is a negative regulator, the alpha 2s, on the preganglionic neuron. So it causes them to be hyperpolarized and stop activating the postganglionic. So negative feedback loop. Here is figure 14.7 in your text. This is a very good summary of all your different areas, your target tissues, which neurotransmitter is going to bind to them, what type of receptor they have, and what their main effects on that target organ are. So this is a very good reference when looking at the effects of the neurotransmitters in the sympathetic nervous system. You can also look over the slides. This has it spelled out by function, which ones are involved in cellular metabolism, which ones are in the cardiac muscle, target for sweat glands, and all the different things that they stimulate throughout the body. And here's effects on other cells by the sympathetic nervous system. And again, this figure 14.7 summary table is an excellent reference when looking at the sympathetic nervous system and its target cells and the receptors involved in each of those. So some people will market supplements to help you lose weight. One of these is Yohimbe, and it is said that Yohimbe will bind to the beta 3 receptors on adipocytes, trigger breakdown of the lipids, leading to loss of fat. However, it also binds to alpha 1 and alpha 2 receptors, causing vasodilation, increasing sympathetic neurons, and increasing our metabolic rate. But this can be dangerous because it also can elevate your heart rate, cause seizures, high blood pressure, kidney failure, insomnia, panic attacks. But fortunately, most people who use it through the skin, and it's not absorbed through the epidermis in any significant amount, so it doesn't get to your circulation to cause these issues. So our parasympathetic nervous system, coming off the brainstem and the sacrum, our craniosacral division, with the ganglion located close to the target cells. We have several cranial nerves involved. Our ocular motor, our facial, and our glossopharyngeal and vagus are all involved in helping to regulate the parasympathetic system out of the brainstem. Whereas the sacral nerves are going to innervate large intestine, urinary bladder, and reproductive organs. Both the pre and post ganglionic neurons of the parasympathetic will only release acetylcholine. So the parasympathetic is only involved with our muscarinic receptors, our cholinergic receptors, which are made up of our nicotinic and muscarinic receptors. So in the parasympathetic, nicotinic receptors located on the membranes of all our postganglionic neurons, whereas the muscarinic are located on the membranes of all our parasympathetic target cells. Here is that same type table for the parasympathetic, but we don't have to list out the neurons or the receptors because we just told you the only receptor found on the target cells of our parasympathetic targets is our muscarinic. The nicotinic are only found on the postganglionic neurons. But then the acetylcholine released for the postganglionic can only bind to the muscarinic receptors and cause these effects on the various organs. So again, broken into cardiac, glandular epithelium, effects on other cells, and effects on smooth muscle cells. Summarized in this table for your quick reference. So some anticholinergic drugs either block the release of acetylcholine or block the acetylcholine receptors. They will cause urinary retention, constipation, dry mouth. When taken, so you have to think about the side effects before taking some drugs. And so they work together to antagonize one another to maintain homeostasis. And so sympathetic becomes dominant to maintain during physical demanding periods, whereas parasympathetic is dominant when we have periods between those increased physical activities. Putting the sympathetic and parasympathetic side by side, you can see a comparison of their main role, locations, location of the preganglionic cell bodies, postganglionic receptors, the neurotransmitters involved, postganglionic neurotransmitters, and the target cells of those. This is figure 1411. And so sympathetic tone dominates blood vessels, keeps them partially constricted. Parasympathetic tone dominates the heart, keeps the heart at an average heartbeat of 72 beats per minute. The autonomic centers in the hypothalamus are going to help regulate. So here is your input, the amygdala and cerebral cortex, go through the hypothalamus. Cerebral cortex goes through reticular formations. Same thing with the hypothalamus. Direct effect of hypothalamus is body temperature, feeding behaviors, fluid intake. Indirect through the autonomic nervous centers, heart rate, blood pressure, organ blood flow, digestion, urinary production, and other nuclei will regulate respiratory rhythm, sleep-wake, and acid-base balance. POTS is a not well understood disease, thought is tied to the sympathetic nervous system and will cause lightheadedness, fatigue, thirst, low blood pressure. And so generally we just treat it with dietary modifications and medications to block sympathetic receptors. But nobody has a real good explanation for POTS, postural orthostatic tachycardia syndrome. All right, that is all of chapter 14. Let me know if you have any questions and have a great day.